Right, good afternoon everyone, and welcome on behalf of KTN to this webinar, Guiding Principles for Unlocking the Workforce. What can mathematics tell us? My name is Matt Butchers, and along with many of the speakers today, I've been involved in putting together a report of the same name, which hopefully many of you have seen in advance. This webinar is a dissemination activity and discussion opportunity for some of the ideas in that report. For those who haven't seen the report, it's not essential background reading, but if you do want to go through it, there's a link at the bottom of this page. So that's tinyurl.com V-KEMS-unlock-public. So Professor Abrahams will speak a little to the background and the purpose of the report and this session shortly. But before we do that, I'll just go through a little bit of housekeeping. So first of all participants except the speakers are muted. I was going to say, do remember to connect your audio by using the join audio, but if you can hear me say that, chances are you've figured out how to do that already. Any technical problems, just drop Poonam a note in the chat function. Around questions and answers around the webinar topics, type them into the Q&A box and we'll try and get around as many of them as we can. And those that we can't get around to, we'll collect them and try and answer offline in a summary note if possible. The webinar is being recorded and will be made available through the KTN website for people to share, watch and enjoy afterwards. Now, on our 90-minute agenda, I'll pass over shortly to David Abrahams, who will talk a little about the context and the background to the webinar. We'll then have 4 short 10-minute contributions which highlight some of the report contents. The rest of the session will be dedicated to a discussion around these topics. So Professors Alan Champneys, Mary Barker and Deirdre Hollingsworth will begin the conversation with the panelists. We'll then try and feed in as many questions from the delegates as we can before we finish at 2 o'clock. So with that, I will pass over to Professor David Abrahams, who is the Director of the Isaac Newton Institute for Mathematics in Cambridge. Over to you, Dave.
Thanks very much, Matt. As Matt said, I'm currently the director of the Isaac Newton Institute for Mathematical Sciences. Welcome, everybody. I'd just like to say a few words just on the context and background, as it says here. So, a little bit of history. When we went into lockdown, we felt that we needed to try and create some virtual environment to allow mathematical scientists to continue their activity both within the subject, but also out with. And so we created something called V-KEMS, a virtual forum for the knowledge exchange in the mathematical sciences, which does what these 3 pillars here say. We wanted to try and create business continuity, so allow business to continue through this difficult phase. And we have on our website various activities and ways of triaging problems from outside to mathematicians. We have a responsive support for emerging threats, which is the middle tranche, and it allows topics which are timely, logistics problems, etc., to be thought about in a more mathematical way by our community, and then continue the activity of the Isaac Newton Institute, ICMS, and the Knowledge Transfer Network in their support for business and industry, and also for the mathematical sciences community. So V-KEMS, as it says at the bottom here, is really a confederation of my institute, the ICMS, which is based in Edinburgh, and the Knowledge Transfer Network, and a number of other key mathematicians. So next slide, Matt, please. So one of the activities we have undertaken is the purpose of this meeting. We got a request from central government of a few mathematicians to go and talk to one of the government departments about what guiding principles can be put into place for helping with workplace rescheduling or operation without knowledge of the complex modeling of the pandemic, without social input in detail, without the latest data, etc. So what can you say in broad mathematical terms, which will give you principles from which you can base guidelines for getting unlocking from the present situation? and that's become very timely over the last 2 or 3 weeks. And they posed a couple of questions in the coloured blobs at the top right, which were exemplars of the type of thing they were asking for, and they wanted underlying principles. So this sort of flow chart at the bottom says what happened. We had an initial meeting, a number of mathematicians. Then I convened a meeting of our V-KEMS group, which produced a 4-page document, of which 1 page really came up with 4 underlying principles. We then very rapidly created a 2-day virtual study group with a number of mathematicians, psychologists, and other people. We then created a long report which was sent to 6 government departments, and they may or may not have informed their thinking, but some of the principles look quite similar to what's already been announced. And then we wanted to make this document, socialize a document for the public, and that was what's created, and you can get access to that, and this online forum is a way of publicizing that and making it more open. So next slide, please, Matt. So it's important to give you some health warning for this. We've only had a very limited time to think about what mathematics can be applied and how it might be applied to create some principles. Nothing has been peer reviewed, and everything is very, very rapidly thought through. So it's intended as a way of provoking further study and policy discussion. So it should not be taken in any way as a definitive response by mathematical community. We needed, as I've said, principles to help formulate coherent and consistent guidelines. We're not in the business of creating those guidelines, and the effectiveness of those principles has to be seen through more quantitative studies. So we don't make any recommendations out of this, but we use it as an important basis from which guidelines may actually evolve. Next slide, please. So this last slide is just shows a picture which we used to formulate our thinking for our virtual study group, which we had a couple of weeks ago. So what happens, we thought up 4 overarching principles initially, which were sort of fairly obvious ones, but from which we could actually start burrowing down to think of more detailed principles about workplace scenarios. And we developed 21 principles in that virtual study group. And the way of guiding it is exemplified by this diagram on the right-hand side, where we used 2 axes. One was the interaction time. The other was the openness or the exclusivity of the work group environment. So how open to strangers it is or closed. And therefore you could then start putting in different types of jobs into the various corners. And it doesn't take much thought to realize that the name of the game is to take people from the top right down to the bottom left, where you minimize the risks. That's one way what we chose to do it. You could have used other axes, interaction number, the distance between people in the workplace, and the principles we came up with have different relevance depending on whether the infection rate is the R number. Let's hope that's the last time it's mentioned here, is either close or above 1 or lower than that. So we came up with the various types of principles which would apply in different opportunities. I think many of them were obvious, but we will allow a route to quantification, as will be seen by some of the examples today. And they came up with some interesting and new concept which you can explore in a way which is perhaps novel and may lead to slightly changed behaviours in terms of guidelines. And so a couple of those are in our document. So I think the final slide, please, Matt. That's enough from me. The main thing we want to get out of this discussion is for you to hopefully enjoy the presentations, which are 4 examples of the working of our virtual study group, which then might lead you to think how they might be applicable or relevant to you in your particular environment or your particular role. And if you would like to discuss any of those, then I think the quickest way is to either email me or Matt Butchers at the KTN, and then we will try and triage you through to the right relevant people in our community. So once again, I'd like to thank everyone who's going to present today. I'd like all the participants to thank you all attendees for being interested in this problem, and hopefully something interesting and important will come from it. And finally, I'd like to thank all of the V-KEMS partners. So thank you, Matt.
Thank you very much, Dave. So I will stop sharing so Ed can share his screen while I introduce them. So our first 10-minute contribution will be a double act between Ed Crane and Christine Curry, talking about scheduling and rotors. Don't forget to drop any questions you have into the Q&A box. So with that, I'll introduce Ed and Christine. So Ed Crane is a Senior Heilbronn Research Fellow at the University of Bristol, and Christine Curry is Associate Professor of Operational Research at the University of Southampton. Over to you, Ed.
Okay, thank you, Matt. I'm going to talk about a little bit of work that I did in a team at the virtual study group with Helen Byrne from Oxford and Ollie Johnson and Ben Lees from Bristol. We're talking about using rotors to minimize the transmission of COVID-19. And the reason for this is that, as you probably know from reading the news, the mortality risk for older people is much, much higher than for typical working age people. For one particular week, it was 40 times higher recently for the over 65s than for the under 65s. So if we think about a typical worker, Alice, from going to work, she gets some extra risk to herself of mortality, but that's already rather small. The prevalence in the UK, estimated by the ONS survey last week, was 0.3%. Her mortality risk if she's under 50 is particularly low, and already things are becoming social norms such as social distancing, improved hand hygiene, and self-isolation of anyone with even mild respiratory symptoms. On the other hand, if she goes to work and she's infectious, she may seed an infection cluster which contains people who are much more vulnerable than her. So epidemiologists often illustrate their infection chains with people starting A, B, and C. So Alice might infect a 40-year-old customer called Bob, and then Bob infects his 85-year-old grandmother, Clara. Her risk of mortality from being infected is very high. So a sensible goal for us, since we can't control what Bob does when he goes home, is simply to minimize the expected number of people that Alice directly infects over the course of several months. How do we model this? Well, we have to assume that infectiousness is proportional to viral shedding, because that's what can be measured. And of course, coughing modifies it, but you can assume that symptomatic cases are going to self-isolate. Viral shedding has been modeled to peak after about 5 days. The incubation period is also random. So how long do you know before you actually, how long do you wait before you know you're unwell after being infected? So we modeled that with a gamma distribution. There's no solid data yet about how these timelines vary from case to case, or with age, or with the severity of the symptoms. So we can do better modeling when we have that data. There's an idea for 4 days on, 10 days off rotors. Originally, this was applied to the entire economy in a paper by Uri Alon. And in the same paper, they also discuss individual workers or individual businesses running these 4 days on, 10 days off rotors. So the idea is to use the timeline of the virus itself against it, so that while you're at work, you're likely to get infected relatively more than at home. And then during the time that you're most infectious, you're likely to be at home rather than at work, where you'll pass it on less. So this idea hasn't really gained traction, although some people in the UK have been trying to promote it. So rather than use a complicated SEIR model on an example network, which is what Alon and Co did, we wanted to boil down the problem to the very basics, minimal modeling assumptions. Let's say we might want to compare 2 rotors with 5 days working every 14. You could do 5 days on and then 9 days off, or you could do alternate business days, which is the second case here. So the main parameter that we needed to look at for comparing two rotors was the ratio of how much exposure you have to other people at work compared with the exposure you have at home. And our rather simple quadratic model did show a benefit. So this top table shows relative expected transmission compared to the standard working week. You can see that 5 days on, 9 days off is not quite as good as 4 days on, 10 days off, but it's still a big help. Good rotors help a lot if there's lots of asymptomatic transmission. They do help if Alice self-isolates at the end of her incubation period. And if you're comparing two rotors where 5 days out of 9 are working days, then it's better to do alternating weeks than alternating business days. And the point of the model was simply that we've taken out all the assumptions about the network. It's as simple as it possibly could be. Okay, I'd like to hand over to Christine Curry now, who'll talk about school scheduling.
Thanks, Ed. Yes, I'm going to talk a little bit about optimal school timetabling. So this is a problem that we looked at as a group, as part of the virtual study group as well. So it's certainly not just me involved in this work. So these are the names here, and then go on to the next slide. And I will try to go on to the next slide. There we go. And we can see some of the things that we were thinking about. So a lot of what we were doing here was seeing how we might be able to manage to use a lot of the principles that we come up with during the virtual study group to put those into practice into a school timetabling. And you'll see an example on the next slide of what that might have looked like. So these are the 3 key principles that we were thinking about. So bubble scheduling was one. So bubbles have been talked about quite a lot in the news recently. They're basically keeping fixed bubbles of people separate in space and or time. And non-mixing, so avoiding mixing in shared spaces. So our focus on this little prototype that we were looking at was avoiding mixing in corridors and between classes. The other thing that this leads to is traceability. So if you don't have mixing in shared spaces and you're just working within your bubble, you've got a clear record of who's interacting with who, which with children in particular is going to be important because they're not going to be, especially the young children in particular, won't be carrying a mobile phone. So even if contact tracing apps are prevalent, they won't have access to them. So this is quite important. Now, what we've looked at is particularly for a school, but this is also relevant in lots of other places. So shift work, universities and other training settings, and just scheduling use of shared space more generally, just thinking about that, how you avoid overcrowding in shared spaces like canteens, parks, shopping districts, etc. What we were aiming to do then, or our objective in this problem, was to minimize the crossover of groups or bubbles in corridors and shared spaces. But because it's a school environment, we wanted to ensure learning requirements are met, that students have a break and they have a lunch. We've assumed max of 15 students here. We've made no assumptions whatsoever about transmission between students or between students and staff. We're just focusing on, if we're following the bubble scheduling and reducing mixing, this is how it could work. And then we've added some flexibility, allowing staggered start and end times for lessons, slightly different lesson durations, and break durations and lunchtime durations, so that we can get a problem that's actually feasible and will fit into the constraints the school might have. So how we've done that is to put together an integer linear program. It's coded in Python, and it accounts for the geography of the school in quite a simple way. So we're not trying to define the geography of every single school, but just looking at what we've called a contact matrix. It's not quite the same as an infectious disease contact matrix. It's really just talking about access points. So 2 points if there's 2 neighbouring classrooms use all the same access points, 1 point if they have at least one that they could go to separately, and 0 if they're miles apart and don't share any access points at all. And this is what you come up with. So it may be hard to see the little ellipses at the top of the screen, but what I'm highlighting are here C1 and C2 are neighbouring classes, as are C5 and C6. This is based on a local school to me. And you can see what you're trying to do is avoid these classes interacting on the way out to break. So in the case of C1 and C2, they share a staircase. So what you don't want is them going down the stairs at the same time. And so the break times are separate. What you can see looks very different from a standard school day, and just gives an indication of how things might work and how following all these principles might affect the structure of the school day for different year groups. This is modelled on a large junior school with 3 form entry and pupils doing a half day. So half in the morning, half in the afternoon, just as an initial example. As we said, no recommendation, that's the way to do it, just as an example of how it might work.
Thank you very much, Ed and Christine. We'll pass over now to Rosemary, Dyson and Arkady Way, if Arkady wants to share his screen. So Rosemary Dyson is a reader in applied mathematics at the University of Birmingham, and Arkady is from the University of Oxford. So over to you guys.
Great, thank you very much. This is work we've done also with Alan Champneys, who you will be seeing later. So what we were looking at was the benefits of transparency. So this is if we know lots of information about what we're doing, how that helps us. So we're particularly thinking about assessing sometime in the future where there is some small residual infection level in the community, but workplaces are beginning to reopen. We have testing and we have contact tracing widely available, and that's has good success rates, but there are concerns over data privacy. So our question is, how can we show that the benefit of full information and transparency is really, really key here? So we're going to assume that we've got a closed workplace with fixed interactions, and we have a fixed and small rate of infection from outside, so that can bring in an infection into your closed society. Okay, so the model. So we've got this mathematical setting. So we have a workplace, which is basically a network of interacting people. So we have people, and then we have the lines between them are basically giving the interactions between these different people. And different workplaces will have different networks. An infection can pass through the network. So if you get one person who's sick from outside, and that will propagate through it like you've just seen. So we can stop this infection propagating is if we use isolation. So the first person got sick and their contact then immediately went home, and it stops it from propagating through the rest of the network. But what happens, this is sort of really dependent on having full information and full compliance with the situation. So we're going to call that transparency. So if we don't know one of our links, we can end up with the infection propagating a lot further because we're not transparent. And what we really wanted to do was to demonstrate kind of what is the motivation, what is the incentive for both employers and employees to make sure they have as much information as possible. That's my key question, and I'm going to pass over to Arkady to talk about the model.
Okay, hopefully you can all hear me. So there are 5 different states that workers can be in here. There's susceptible, there's exposed, there's infectious, there's away and unwell, and then there's away and well. And you can see on this timeline that workers always start susceptible, which is shown in green here, which is where they're well, but they can catch the virus. And then at some point they become exposed, which is shown in amber. Now this means that they're infected, but they don't know that they have it yet. And crucially, they cannot infect others at this stage. But then after that incubation period, they become infectious, which is red here. And that's when the worker still doesn't know that they have it, but they now can infect others. And then, as Rosemary said, there are 2 different types of workers. There are transparent workers and there are opaque workers, and they deal with this infectious state differently. So transparent workers have been tested and are well informed, and so as soon as they have symptoms, they go home. And so they move to the away unwell state, represented in black on this timeline, where they stay for the whole of the symptomatic period. And then after that, they stay at home for the rest of the isolation period, which is the magenta part, before they end up returning to work, where they're then susceptible again. On the other hand, opaque workers aren't as well tested or as well informed. And so although there's some small probability that they do go home, so for example, if they're really ill and they can't stay at work, most of them usually spend the whole symptomatic period being infectious at work. And to make things worse, other workers don't know that they're ill, so they don't self-isolate because opaque workers don't warn them that they're infectious. And so after that infectious period, then they become susceptible again. So notice that no one becomes immune after this stage. Everyone's moving back to susceptible. But we can view this behavioral model as a network of nodes and edges, which I'm showing here in the bottom left corner. And the round nodes represent transparent workers and the square ones are representing opaque workers. And an edge connecting the two nodes means that they're frequently in contact with each other. And so in the network diagram here, node 0 is round and green, so it's a susceptible transparent worker. And node 2 is square and red, so that's an infectious opaque worker. And then there's that edge between 0 and 2, so there's a chance that 2 is then going to infect 0. On the right here, we're showing that we can use this model to measure some key outputs of the workforce. So that's things that employers or managers of the workforce might like to know. So for example, we might look at the proportion of the workforce that was exposed at least once, or the maximum portion of the workforce that was ever ill at the same time. So how does this simulation work? So here we're showing a workforce of 8 workers, and the top half are all opaque because they're squares, and the bottom half are all transparent. And you might imagine a scenario where half of the workforce are being tested and the other half are not, but the company somehow thinks that these halves are separated, but they're actually not quite, because 4 and 3 clearly are connected here. And so initially worker 0 is exposed over here, and all other workers are susceptible. But then after 2 days, which is the incubation period here, 0 becomes infectious and now can spread the virus to other workers. After another 2 days, then 2 and 3 are already exposed as well. And then after less than a week, the whole of the opaque half of the workforce is ill. And they've not been tested or haven't been informed about how to check their symptoms, so they are still in the workforce. For a while, 4 doesn't know it's infected, so it spreads the virus to 5, and then 6 and 7 are lucky and they're not infected. But as soon as 4 becomes symptomatic, it goes home this time. And because it's a transparent worker, it tells all its neighbors to go home too. So 4 and 5 go home ill, but 6 and 7 are safe and go home well, where they can work from home now. But since 3 is opaque here, it doesn't listen to the advice of 4, and so it stays in work. And now that 4 and 5 are at home, 6 and 7 are able to return to work well. And then 4 and 5 then go through another period, the magenta period, where they're well but work from home. And then finally, eventually, the whole transparent half is back in work. But the virus, as you can see, is still being passed around in the opaque half, which of course leaves node 4 here vulnerable to catching the virus again. So we can summarize these simulations by looking at the proportion of time that the workforce spend in each state. So for example, here we can see by looking at the green bars that, as we might expect, the more transparent workforces are ending up spending a large portion of time well and at work than the more opaque workforces. And then we can also see by combining the areas of the orange, red and black bars there that the more opaque workforces are spending a large portion of time being ill than the transparent workforces. And then we can also take an average over many of the simulations and look at some key outputs of the workforce. So we can view these measures as functions of either the opacity of the workforce or the connectedness of the workforce. And here we, for example, looking at the black line, the black dotted line here, we can see that the proportion of opaque workers in the workforce is increasing. Then so too is the proportion of the workforce that were exposed at least once. And in fact, by the time that 60% of the workforce are opaque, then everyone in the workforce is exposed at least once, as we're showing here with the yellow line. So that there's at least one day when the whole workforce is ill at the same time. I'm going to hand back to Rosemary for some take-home messages now.
So what our models have really shown is that transparency is sort of essential. And this is somewhat unsurprising, but it really kind of quantified the issues here. So it reduces the total number of infections, it reduces the time away from work, and it also reduces the number of days where your entire workforce has got to be at home, so where you have to completely close down your business. So it's really important that people incentivise compliance. So they incentivise testing, they incentivise obeying the rules. And so we originally called this principle no stigma. So we need to make sure that there is people have no problem with saying, actually, I'm sick, I should go home. So it's really important. Our conclusions are sensitive to the network structure in the office, and we obviously need to run them with real parameter values and potentially try and do some analysis on it. We pulled this together very quickly. But the big advantage here is it's a very simple simulation, so we can run it very rapidly to design safe workplaces for the future. Thank you.
Thank you very much, Rosemary and Arkady. Next up, talking about the postcode principle is Professor Tim Rogers, who's Professor of Mathematics at the University of Bath. So I'll let Tim share his screen at this point.
Right, so this is joint work with Albert Sola-Villalta and Amy Wilson, both from the University of Edinburgh. And we've been investigating the possible benefits of using existing geographic organisation structures as a way of subdividing a population. And I'm going to talk for now about postcodes, but in terms of an individual institution, you might also think about workers in a building, for instance. So I'm going to start by giving you a fairly crude comparison, but it illustrates the point very well, I think, between the spread of the bubonic plague and COVID-19. So the picture on the left here shows how there was a wave of infection that travelled across Europe and took many years to do that. This is in the 1300s. Compare that to COVID-19 that spread across the world in a matter of months. So what's different? Well, in fact, you all already know the answer. These things are different. So transport and social networks. In the 1300s, people traveled by foot or by horse mostly, and they lived in small communities and seeing the same people all the time. Nowadays, we have an airline network that spans the globe. This is a map of popular airline routes from when airlines were still operating, and social networks that span countries and span the globe. And this enables the exponential spreading of a disease. So this slide is just for, in case you've been living on the moon for the last few weeks, if you've never heard of R0. So outbreak size is a function of this basic reproductive number. And you can think of this as having a component that's to do with transmissions between people and a component to do with onward routes through the social network. Now, if you restrict interpersonal contact networks, then you can reduce the onward spread of the disease. So we're going to think about doing that with some kind of geographic based restriction. So home rule, which is quite strict, and it has a few drawbacks. The first of which is urban versus rural disparity. So if you live in the center of Paris, there's a bit more going on than if you live out in the Alps. And the second is more subtle, but overlaps between these 1 kilometer regions, they actually connect very many people. So it's possible to transmit this disease across the city still only using these 1 kilometer rules. So can we do better? We need a way to divide into regions according to the density of homes and businesses. And in fact, we already have that. That's the postcode system. So here is BA2 7AY, that's the University of Bath. And this is the map of the BA, the Bath postcode area. And the first 3 characters, this is the postcode district. and that contains a substantial chunk of the geography. And you can see they're all different sizes. So BA2 contains 74,000 people. It's about 150 square kilometers. But the sizes of postcodes flex to reflect the fact that they're lists of addresses fundamentally. So you want them to be about the same length. So they flex naturally according to the density of homes and businesses. So our question is, could we use these as a guide to reducing exponential spread? So here's a scatter plot of UK postcode districts, and Bath is somewhere right in the middle here. And what this is illustrating is that even though they spread over a huge range of geographic areas, the population density is total population numbers are pretty similar, and they only mostly vary over one order of magnitude. Okay, so rather than using real data, we were in a hurry for this virtual study group, so we've designed a stylized model city that's going to illustrate some principles for restricting movement based on postcode. So here we go. We've got 12 postal districts. These are the black boxes. Some of them are large, representing suburbs, and some are small, representing city centre districts that are more densely populated. There are 200 households per district. Those are the blue dots. And there are 8 destinations per district. Those are the red dots. And then every household has 2 destinations. So that might be a workplace or a school or both or something. So this is the network of people traveling to destinations. How is this affected if we apply different lockdown or reduction of movement strategies? Well, a very tight restriction would be to stay within your postcode. So only those who have a school or a home in the same postcode district as them will go to that destination. Now that reduces the links very significantly. Only 8% of links remain. A more relaxed restriction would be to choose 2 districts. So you could have your home district and then one other district where you go to work. And in this scenario, 58% of links would remain. So we're going to compare these 2 scenarios to the equivalent distance-based measure. So these are the networks that would remain for 8% and for 58% of links when we use a distance from home rule. And I'll show you, these are the sizes of the distances. These are the disks that people would stay within. So if you only stay within this small disk here, you get 8% of links. If you have a larger region of movement, you get 58% of links. So let's compare the performance of these different restrictions. So firstly, let's look at the tight restrictions. Now, if you're in a tight restriction, why would you need a tight restriction? Well, that would be if you think there's a high risk of a large outbreak happening and you want to really constrain that outbreak. So what you really care about is the largest mutually connected cluster. So these are the people who are at risk of transmitting the disease between each other. And here you can clearly see this large, so in each side here, we've simulated and found the largest connected cluster. And we found a much larger connected cluster in the distance-based restriction. And that's because of overlap between the central high-density districts. So there are a lot of vulnerable people in the network sense in this group here. And then let's look at the weaker restriction. So this is easing of lockdown. So when you have you're trying to get people back to work, what do you care about? Well, you care about slowing down the spread of the infection so that contact tracing, for instance, can do its job. So these curves here, we're plotting the time. So we simulated a disease spreading through this network of households. Units are mean infection delay. And then we're looking at the fraction of the population that's infected. From 0, nobody infected, to 1, everybody's infected. So the black curve is no restriction. You get a very sudden outbreak where it sweeps through extremely quickly. Red is when you use the distance-based lockdown. And blue is when you use the choose 2 districts rule. So you can see that the blue scenario is by far the slowest. So you can slow down the infection spread quite dramatically while still remaining everybody being able to get to at least one workplace in this situation. Finally, following on from the last talk, we need to think about imperfect adherence. All of these policies that get suggested are sensitive to people not doing them properly. And we need to check how robust they are to that. So here we're thinking about, this graph is showing what happens when you add additional links that are outside of the allowed zone. And then one measure would be time until 20% of the population is infected. And we basically find that, okay, so these are sensitive to, unintended behaviors, but generally the distance-based measures seem to be more sensitive and district-based measures seem to be more robust. So that's it for me. I hope I've gone quick enough for everybody. These are the findings and the caveats in the future work. So we think that postcodes or other geographic separations could be really useful as guiding principles for reducing interpersonal mixing and hence disease spread. Stay at home and choose 2 districts both seem to provide superior benefits. And these ideas could be taken on as institutions. If you think about people moving between buildings in a university, for instance, if you only have 2 buildings you're allowed to go in, that's another kind of principle that would reduce the speed with which an epidemic might spread through the workers and students at a university, for example. In terms of caveats, obviously we have to say this is a highly stylized model. It's only the first step. And in particular, the social network here is totally homogeneous and random, and that's not really reflecting of reality. And of course, we have to be careful about imperfect adherence. Now, for future work, it's actually possible in a lot of contexts to get decent data on workplaces, where people live. In terms of universities, you know where students are housed, and you know what lecture theatres they're going to and all this sort of thing. So it is possible to implement it, but more detailed modelling work needs to be done. Okay, that's me. Thank you.
Fantastic. Thank you very much for that, Tim. So for our last short contribution, I'd like to pass over to Sam Tickle and Sam Johnson to talk about the supermarket problem. So Sam Johnson, if you want to unmute yourself and share your screen. So Sam Tickle is Data Science Hardborn Research Fellow at the University of Bristol, and Sam Johnson is Lecturer in Applied Mathematics at the University of Birmingham. So over to you guys.
Hi, so I'm going to talk about what we call the supermarket problem, though we think it is probably relevant for other situations where the groups are open and the time of interactions are relatively short. This is work done with my colleagues Chris Bird, Kieran Calvert, and Sam Tickle. So when people are shopping, there are basically 2 problems which can arise. One is the customers moving around the shop and potentially infecting each other, and then what happens when people are queuing. What we've found is there are 2 general principles which emerge here. One is that it may be more important to minimize the interaction time rather than always to focus on reducing the number of potential contacts between people in this kind of setting. And the other is that it's particularly important for the servers to have as much protection as possible, perhaps much more important than other customers. So we study this supermarket as a model of agents and individuals, some of whom, one or perhaps more, are infected. And this model is continuous, so they walk around, as you see here on your right. And every unit of time, if you're a susceptible individual, you will receive some dose of virus, which depends on your distance to the infective or infectious individual the virus is coming from. At the moment, we'll just leave this as a function f. And then over some period of time, you'll get a total dose E, which is the sum of FR over your root. And so then at the end of the day, you'll become infected with some probability P of E, which we're also keeping an open mind about what kind of function would that be. But already with this, you can ask some questions such as, is it better to walk past an infectious individual coming at potentially some short distance delta, like here, or to stand some distance away for a given amount of time? So in this case, for example, is it better to be this happy fellow here or the more morose one standing over there? This is easy to calculate. So here we have several different panels describing different sets of parameters, but the way to read these panels is shown in this diagram on the right. If you're above a given curve, then you're safer to be the person walking past. If you're below, it's safer to be standing nearby. So these different panels describe different potential ways in which the virus decreases with distance to the infectious person. So for instance, our base case might be just a diffusion, which depends on the square of the distance, like gravity. But if you have things like droplets falling to the ground or evaporating, you might have shorter range interactions. If you have convective currents, sneezing and things like that, then you might have longer range. The way to read this is to say, like in this example here, well, say the decay rate goes with the cube of the distance, so it's fairly short range. is it safer to stand for someone to walk past someone else at say 50 centimeters, which would be around here somewhere, or for instance to stand for 2 minutes at a distance of 2 meters? Well, in this case, the person walking past is safer. And when we look at all these different panels, what emerges is that there's a general principle that walking past seems to be safer in most situations. This depends on this function f, but this is quite a robust finding. Okay, so what happens if you simulate something like this? So we've got a model here where the shoppers move around, one of them is infectious, and we can make them move around in different ways. And one of the things that's been proposed is to try and organize the way people walk through, say, a supermarket, maybe making them follow some sort of structured queue. Well, here we can simulate that, and the panel on the top left shows the amount of exposure that the different individuals accrue over time. And what we find is that the two people who are near the infectious individual accrue more and more viral load. Everyone else is fairly safe. And on the right, we have what happens if everyone just moves about freely. And there you see that that same dose is more distributed among many people. So no one accrues a very high exposure. That's with social distancing, so people avoid each other. If the infectious individual doesn't respect that social distancing, then it's much worse in the case of the structured queue, but it's not very much worse in the case of the free movement. So already from this model, we can see that free movement shopping may be better than one-way structured queuing. This is different from another effect that we know of, where structured queuing can make people stay longer in the shop. We're simply saying, even at equal amounts of time, it can be better to move about freely. But this begs the question, how do you become infected given your dose? So is it better to give one person a fairly large dose, let's say n times E, or give n people a smaller dose E? Well, we can calculate the expected number of infections in each case. And this depends, of course, on this probability P. If, for instance, the probability were just linear, so the probability of being infected is proportional to how many viruses you get, for example, then it would be exactly the same. However, in biology, many things are nonlinear and often modeled with this kind of sigmoid. We don't know of any biological reason why this should be the case for this infection, but we have seen many papers where they assume that there's a minimum infective dose, which would be more consistent with this sort of sigmoidal shape. Then what happens is that it depends where you are. If you're on this lower side of the curve, then it's better to distribute the virus among many people than to give it all to one person, because this is superlinear. Of course, the converse applies if you're on this other side of the curve. Now, where do we think we are, for example, in a supermarket? Well, essentially this inflection point will probably be somewhere around midway. So if that's the case, then if no one is very likely to be infected, so even the chap who gets n times E dose is still less than, say, 50% likely to be infected at all. In that case, we're probably in this regime where it's better to distribute. So we can extract this principle: don't organize movement unless space is very crowded. So for instance, in a supermarket where we expect we can keep things quite sparse, so we wouldn't be expecting anyone to get infected, then it's better to let people move about freely. If this was a crowded environment where you can't assure that, then it's probably better to make them move around in an organized way. This, of course, depends strongly on this P being a sigmoid, which is something we don't know. And so now I'm going to hand over to my colleague Sam Tickle to talk about queuing.
Thanks very much, Sam. Hope everybody can hear me. So as Sam was just mentioning there, free movement seems to be preferable to structured queuing in many cases. However, sometimes this will be unavoidable. Sometimes a queue will be necessary. And so we ran a queuing model with, in addition to arrivals and services in the queue, 3 types of unsafe interaction that could potentially lead to the spread of infection. So the first type of unsafe interaction that can occur is that between 2 customers, denoted here by the double-headed green arrow between the 2 red dots in the queue. The second type of unsafe interaction that can occur is between a server and the customer that they're serving, denoted by the double-headed green arrow between the blue and the red dot. And finally, an unsafe interaction between any 2 servers on the same shift. And to show you the setup of the experiment, this is on the next slide. So we simulated 1 week of activity at, say, a takeaway shop, a queue under very pessimistic assumptions to try and keep this as robust as possible, to record the total number of new people infected. And our base case involved 2 servers mandated to wear masks with additional safety. So, for example, a small screen at the counter in place. And so we looked at, for each of these experiments, starting with the base case, varying the number of people in the population who were wearing masks, but also thinking about increasing the unsafe interaction rate, where the unsafe interaction rate, as I reiterate, is an interaction that could lead to the spread of infection. And so on the next slide, we'll see some general principles arising from the base case and certain relaxations from the base case. So in the base case, if we remember, we have 2 servers, we have PPE, we have a counter in place, for example, of extra protection. And what we see is that keeping unsafe interactions to a minimum is much more important than customers being mandated to wear masks. While this is still measurably useful if more customers are wearing masks, it's by no means as effective as making sure that unsafe interactions are minimized. If we remove masks from the servers, then this has a marked negative effect on the number of newly infected people across 1 week. Ditto for no safety. However, this is not quite as bad as if we remove the masks. If we remove both masks and the additional safety for servers, then this is worse than the sum of its parts. It's an extremely bad example, as we'll see very shortly. However, the one example that seemed to give us a lower number of infected people is if we used more servers, in this case 4 servers rather than 2. And the key reason for this is, of course, it reduces average server time in the queue, which massively reduces exposure and infection rate, as Sam was talking about before. So on the next slide, we'll see a kind of worst case, which is the base case, but assuming a very high unsafe interaction rate and removing masks and removing safety. And I should stress, these are under very pessimistic assumptions for how the virus is operating. I've essentially taken all the kind of known parameters and made them 10 times worse. But you can see that under any proportion of people wearing masks, we get a reasonable number of new people infected just inside of 1 week. However, if we take the best case, and remembering that we're still under very pessimistic assumptions, and we have here 4 servers, masks, additional safety, and a low unsafe interaction rate. So for example, 2 per hour for any given pair of people in the supermarket. Then with 95% confidence under very pessimistic assumptions, assuming a reasonable number of the population are wearing masks, then at most 1 person, we say, would pick up the infection inside of a week. And I think that's all I have to say for now. There are some references here to back up some of the more pessimistic assumptions we've made. And if anybody has any questions about these assumptions, then feel free to ask away. Thank you.
Wonderful. Thank you very much, Sam. So those were 4 very quick summaries of some of the principles that were being discussed during the virtual study group. So these weren't about generating advice, but rather highlighting where mathematical science might provide some input. So thank you very much to the speakers and all the other people who have been involved in putting some of these ideas together. So at this point, I'd like to begin the discussion part of this forum, and I'll pass over to Alan Champneys, Mary Barker, and Deirdre Hollingsworth. So Alan Champneys is Professor of Nonlinear Mathematics at the University of Bristol. Mary Barker is Professor of Psychology and Behavioural Science at the University of Southampton. And Deirdre Hollingsworth is an infectious disease epidemiologist at the University of Oxford. So with that, I'll pass over to Alan, if you're happy to kick off the discussion, perhaps with some questions that have already come in, but I know there are some pre-lined up from Mary and Deirdre. So over to you, Alan.
Hi, everyone. Yeah, so we're now going into sort of question time, if you ever watch the BBC show kind of mode, where we have a couple of pre-prepared questions, and then we will open it to the audience. So please do use the Q&A window. Some people already have, to pose any questions that you might have or things you'd like to address, and we'll get around to hopefully answering as many of those as possible. But I'd like to go to Mary Barker, who, as Matt said, is a behavioural expert, to ask the first question.
Thank you very much, Alan. That was absolutely amazing and fascinating to hear it all rehearsed so tightly again after the 2-day workshop. So all my questions and all my interest, I guess, is going to be about the application of your principles, because that's what I'm interested in. I'm interested in how we make these things work with the people that we're applying them to. So first of all, my main question for the presenters is, what do we think are the key assumptions that we're making about people and their behaviour when we're designing these principles?
Okay, very good. Perhaps we could go back through reverse order to the 2 Sams, because that was the most obvious one where you're making assumptions about how people behave in supermarkets. And perhaps you'd like to comment on that to begin with.
Thanks very much for that, Mary. Yeah, so what we assumed was a very large denominator population. We assumed a subset of the population that was more careful. So, for example, just take health workers as the kind of shorthand for this, who are wearing masks and know that they're at a higher risk. We then assumed that most people are then obeying social distancing guidelines. However, that unsafe interaction rate that I discussed earlier is essentially a function of how obedient people are to that. So if that is high, then that essentially is showing that people are not really paying attention, and there's a lapse and there's more opportunity for the virus to spread. And as you potentially saw from those final numbers, there's a great deal of sensitivity to that parameter.
I wondered the same about the, Sam, yeah.
Well, just to maybe add to that, in the part that actually Kieran did and I was talking about, where we look at the simulations and we can compare the case where there is social distancing and the one where there isn't, we showed, well, we wanted to model what happens if people don't respect those things. So one thing is to look at the cases where people are respecting social distancing, but it might be important to model what about if they don't, and then which is the most robust strategy in that case. And I should also say that many of our strongest assumptions really, or the place where we really need more information, is more to do with actual physical properties of the problem. Like how do these droplets diffuse? How likely are you to become infected if you ingest some droplets? Those things seem to have changed more our outcomes than whether people mingle about in different ways, I would say, in this particular problem.
I also wondered whether Tim wanted to say something. I mean, it strikes me as a wonderful idea to say that people can only spend time in 2 postcodes, but the temptation to, nip across to the next door postcode. So I wondered how robust your modelling is to compliance.
I think that's absolutely crucial, that whatever is proposed needs to be, we need to understand how sensitive any kind of measure is to non-compliance, because you're always going to have a proportion of people who need to behave differently, either because they have some urgent thing, or that they simply haven't understood the rules, or there's all kinds of reasons. And a lot of effort, as the economy opens up, a lot of places like schools, they're facing it first. Everywhere is going to be putting huge amounts of effort into scheduling and sorting people out and all this kind of stuff. And it's really important that we understand how much payoff there is if those schedules aren't followed perfectly. And I think that mathematical, and to me that's not obvious. And the answer is not obvious at all, and it needs to be modelled. And I would say that the work we've done is not an answer, it's just pointing out the necessity of doing the modelling.
Mary, did you want to come back on that? Yeah,
because one of the things that struck me is that how does that model apply to large workforces that have to commute great distances? For example, for many businesses in London, they rely on commutes over long distances. So clearly you have a lot of exceptions to the 2 postcodes, or maybe the 2 postcodes are very disconnected. I'm not sure. I wasn't sure how that would be accommodated.
I think your second comment, that they would be disconnected. So for instance, you could have you could travel the length of the country, provided you stay local within that place. I mean, one of the other things is that many people don't actually have huge social interactions that close to their homes, because most people's friends are spread all over the country these days. And I think the business about the exponential spreading, it's really facilitated by that really long range and really 6 degrees of separation kind of idea that we're never actually that far away from in network distance from anybody else in the country. Now, going back to the 1300s is obviously people's social networks were tightly constrained then by the limitations in travel. Now we've got this, at the moment there's a no unnecessary journeys or something like this, some guidance like that. I think that any kind of more principled and easier to follow rule probably would be helpful.
Suggesting that the 2 postcodes would therefore be a nice, simple, clear piece of guidance.
For instance, yeah, because most people know their home postcode and they know the postcode of their place of work.
It's an interesting idea, and I don't know how many people. You said most people's friends are spread all over the country these days. I wonder if that's actually true.
Well, yeah, that's a very good point. I mean, that might, you know, okay, so amongst academics, that probably is.
Sure, it's true.
In some parts of society, probably absolutely isn't true. Certainly, my child's friends are not spread all over the country for the most part. Yeah.
So one of the things that we know works really well is that if you co-design changes, you co-design the rules around the way people are being expected to behave. And I wondered how we accommodate that need to co-design with these very clearly defined mathematical principles. And I wondered if anybody had any time to think about how we might do that.
I think that's a good question. I mean, one of the things we have to talk about generally is that this isn't advice, but I wondered if we could go back to the first group with, you know, if you take the school timetable, for example, that's sort of a closed-ish problem that you might codify. I wonder if Christine, who is an operation researcher, might have something to say, or Ed, about how you might deal with some of those questions, some of those scheduling questions.
I'm happy to start by giving an answer. So yeah, I agree that you need to talk to the teachers. We're putting together principles and looking at how these things might work and what might be feasible in a school, but we don't know everything and we don't know the ins and outs of particular schools and particular needs of the pupils. So yeah, I agree. I think what we're aiming at here is kind of coming up with this is the way it could be done. Now you fit it into your practical needs and how that would fit within your staffing needs and your pupils' needs. And so those kind of fine tuning of the actual processes would be done within the organisation that followed them, I think, rather than kind of saying follow this schedule for your 12-class primary school exactly, for example, would be my feeling.
There was also an interesting point in answer to this. It was a question which seems to have now disappeared from the chat from Ian, a psychologist at Bath, saying how many of these things could be codified in a way that actually makes sense, so that people would say, yes, that's something that I would naturally want to do, and that I'll just leave that hanging, perhaps. Or I don't know if anyone else wants to come in and answer to this point about codifying and getting people to find it a simple rule to follow.
Yeah, I think this is a very important point. I think at the outset of our answering the question of are there any principles, then I think we tried to, I'll just put my video on, we tried to think in terms of principles that have something which the general public can understand. So any guidelines which follow from it can be actually followed because intuitively they make sense because of the underlying principles.
Mary, did you want to come back with a final follow-up, or yeah?
Yeah, just to wrap up really, I suppose in response to what Christine was saying, then I guess people are going to need to know how much flexibility, how much those principles can be flexed before they become ineffective. And I mean, I'm sure that's I'm assuming that's a mathematical modelling thing that I don't know. But I think that's really, I think it's in line with that kind of common sense. How do we apply these principles because we'd like to do that? I mean, I can already hear in my head the number of teachers I know going, well, that's completely just not going to work because of X, Y, and Z. And then you'd want to know, presumably, how much that's going to compromise the value, the impact of your principles. And that's a very difficult and complicated and a very emotive conversation with a bunch of teachers as well, I should imagine.
I think that's a very good point, and it touches on what Tim was saying about the 2 postcode thing. You can assume that it's all random, whether or not people obey the rules or not. But then, of course, there are herd mentalities. So, you know, which is a psychological principle that's hard to follow. You know, once you start getting the anti-lockdown protesters, etc. But I wonder if in answer to that, it would be useful to bring in Rosemary or Arkady, because that seemed to be about this piece about compliance and trying to put across the message of the benefit of compliance. I don't know if Rosemary or Arkady wanted to say something in answer to that.
Yeah, I can say something. So yeah, as Alan said, it's very much what we were trying to do is to show how much compliance do you need for it to make a difference. And so I think we were trying to hope that by being able to demonstrate to people what was going on, and be able to really clearly show them that you need potentially a certain critical level. I think we're not quite confident enough about our simulations yet to say that there's definitely a critical value above which you have to be. But being able to sort of show people exactly what a difference it makes if they do what they're supposed to do versus not doing what they're supposed to do. And also we were thinking about depending on who you are, you probably have a different motivating factor. If you are an employee, potentially what you want to make sure is that you don't get sick. And maybe you also want to make sure that your friends don't get sick, because these are probably the people you're seeing around the place. As an employer, you possibly have a temptation. Some employers may have temptations to try and encourage your workforce to stay in work as long as possible, or you may accidentally encourage them by, you don't pay them if they're off sick or something like that. And so then you want to persuade the employer that they should be encouraging people to do this by showing them what the value is to them long term of making sure that the most number of employees stay at work and you can keep your business open. So it's sort of different motivators change how you're going to sell this, I think.
We may have time to come back to this. I mean, this is all fascinating, but I do want to bring in Deirdre now, who is a data science expert and is currently one of the co-organisers of a long Newton Institute programme looking at pandemic modelling. So Deirdre, did you have any questions you'd like to ask?
To unmute. I actually have one which Rosemary has effectively answered for me slightly. So I thought there was loads of interesting results. And I was just going to ask the speakers if they could turn it around a little bit and make a list of questions which they would ask, a particular primary school or a particular workplace. What do you want to minimise? What's your tolerance on that? And then from that they could then map out these schedules or these movement patterns. And as we know, it's very difficult to minimise multiple functions at once. And sort of start that conversation around what actually how do you want to minimise risk, which risk is most important to you. But I wondered if the modellers could help us identify which criteria are likely to clash the most for these different scenarios.
Very good. Maybe we could start with Christine and Ed again around this scheduling and timetabling, etc. So that's an interesting one about how you try and make compliance work with that, etc. What information would you need from the client? How would you need it to be a two-way journey? Yeah.
One thing that I tried to illustrate in my presentation was that the incentives to the employer are not very well aligned with the incentives to society in general. So the risk of my example worker, Alice, becoming infected, the downside of that for the employer was mainly that she would be off work for a couple of weeks. The downside to the people she potentially infects is not one paid by the employer. So I think aligning incentives is one of the trickiest things about this.
I think that's an extremely good point. I also wondered about with the Arkady perhaps or Rosemary about this idea that actually it's for the good of the whole workforce. I mean, it clearly depends on the nature of your employment. Mary was talking about the shopkeeper in central London whose supply chain is coming from a long way away, or we talked about schools and postal workers and supermarket. But in an office environment or a factory or a closed workspace, could there be some alignment if you can persuade people that the objectives of the employer can become aligned with the objectives of the individual?
I think although obviously our simulations were very preliminary, we did already show towards the end that there could be aims that the worker and the employer had, which were different, but which behaved the same. So they had a similar curve, and they actually reached their optimum at a similar proportion of transparency of the workforce. So I definitely think there is room for that, in our case at least. Just to address the question as well of what we would want to know, I think it depends a lot on, well, it ultimately depends on what the parameters are of your model, and in particular how complicated you want your model to be. So if you want your model to simulate real life to a higher degree of accuracy, then you need to include more parameters in your model. And so there are many more questions that you need kind of relatively precise answers to. But if you want kind of a very similar, a simple model that you can maybe simulate many times just to get a rough idea of what's happening, then actually you can bound the number of questions that you need to ask.
Yeah, I think this is a good point, and I'm seeing some things in the private chat here around it's so important that you use mathematical modelling as part of a process, that it's engaging with the stakeholder or the user, the employer or whatever, to find out what the real questions are, and then it's pointless to come up with the perfect model with all the parameters if there's so much uncertainty and if it's not communicable and it's not followable. Deirdre, was there anything you wanted to come back to on that?
No, I think they covered a lot of the things I was thinking about in terms of, that individual versus community risk. But in terms of, if you're designing a queuing system, as a one-way system through the supermarket, or, allowing somebody to have a fast lane to go through, this idea that, like in the swimming pool, you have the fast lane and the slow lane, it's how do supermarkets kind of use the information that you're giving them, or how do primary schools use the information that you're giving them? It's a really hard thing to do, but if you could think about what list of questions you'd have, I think that would be helpful.
Yeah, I think that's a really good point, and it's coming up on what is advice? What is a mathematical model? There's a repeated question that's coming up that says, are we in danger as mathematicians of appearing like boffins? And the example of a sock manufacturer is coming up in the Q&A here, who wants to open his or her sock factory, doesn't have time to engage with mathematical modeling, reads the document, adopts a principle, doesn't understand the caveats, and then goes ahead and does something that's counterintuitive and ends up being to all our detriments. How do we avoid that problem whilst also understanding the list of the sock manufacturer's requirements? I wonder if we go back to the supermarket example. Perhaps the supermarket team would like to answer Deirdre's original question, and me moving it in a completely different direction, perhaps you should just ignore.
Okay, sorry, can you remind us what question exactly?
Yeah, the question was, how do you come up with a list of requirements of the organisation, the supermarket, to really understand what are the important things that they are trying to optimise, rather than thinking that we know what the answer is as mathematical modelers?
My guess would be that it should seem as simple and intuitive as possible, and for example, and not overburdened with rules that maybe are not even useful, or if they are, they might have negligible effect. So for instance, when we found that free movement of shoppers could be better than organizing queues, or in any case, it depends a little bit on things that we don't know. It seems to me we should then advise, well, don't try to organize your shoppers because it's very complicated, you might make it worse. It's better to focus on things that really do make a difference, like have as many servers as possible, for example. That might seem counterintuitive because they might be super spreaders, but actually it helps in modeling Sam's done.
So there was a follow-up to that, Sam, whilst you're there. GK Still was asking, I think it came up in this context, is there any research on how long it takes for the virus to infect a susceptible person, so that reducing the time in exposed spaces is actually the best way of, or reducing time in closed spaces, in close proximity, is a better way, or could be a better way? What evidence do you have for that?
very little evidence. So I've looked around a bit. I mean, I don't specialize in this at all, but I haven't been able to find anything very concrete. I think the only thing we can safely say is that if you're standing for a given amount of time in the presence of some air that has viruses in it, then on the whole, you'll receive more and more of it as time goes past. It should be linear how that increases in time, unless you hold your breath or something. So that is probably true, but everything else, so how it decays and then how likely is a virus to infect you? Does every virus have an independent probability of infecting you, or is there some kind of interaction between them? How does it, is the immune system much better at stopping just a small number of viruses than if they get a bit of a head start with a bigger viral load? From what we've read in sort of medical and biological papers, there isn't much consensus on these things at the moment.
If I can jump in here, I think one of the great things about a supermarket is that we know the geometry. We know quite a lot about what's going on. And one of the RAMP teams is looking at aerosols and droplets and surface contamination. And I see this as very solid science that feeds into this. And I think we should certainly do that. And really, really important, we start talking to the people that run supermarkets, bring them into this dialogue as soon as we can. The thing I like about this supermarket problem is very well defined and everyone has to do it.
So here's a question. I think you posed this question, Chris. You could turn it round to the sock manufacturer or whatever. How do we engage with them? Clearly, the stereotype about how mathematicians engage with problem owners or with stakeholders is we try and solve a perfect problem and come up with an answer too late. If Sainsbury's phoned you up and said, I've read your paper, can I open on Monday? How should we engage with such questions?
Well, the simple answer is they are already engaging and we need to start talking with them more. So again, the RAMP group, they are engaging with that. So we need to engage with them through that.
Can you tell everyone what RAMP is, Chris? I'm not sure everyone knows.
RAMP is the, Rapid something Pandemic. It's the Royal Society grouping of researchers that are working on various problems associated with the pandemic.
I have another question that came out of the questions we're seeing. What if, so we talked about trying to align answers with what people fundamentally believe, seems to be the right thing to do. How do we put across counterintuitive conclusions, like the perhaps not going round in an orderly queue, but allowing this rapid part? How? I mean, maybe I'll open this up to Deirdre and Ian, if he's still here, and some of the more policy-minded people or behave people. How do you try and persuade people of counterintuitive principles, or should you?
Nice, easy question. I think you have you just have to lock it into their real world understanding. You need to give them something that they can put their hands on. And I think, the way it was explained today, with a few tweaks would do that. I don't think there's a big leap to be had there. But then they want to know how to apply it in their actual setting, and that's always the more challenging bit.
Yes. And Mary, sorry, I meant to bring you into that as well. If you're still here, I'm not sure.
I am, yes. And
yes,
I think I don't think it's as big a problem as you might think, because actually people have been following changing guidance throughout the whole of the lockdown. The guidance changes continuously, and people have been doing really very conscientiously, as far as the statistics have suggested, doing their best to follow the guidance. So I think as Deirdre said, I think if you explain it in the beautifully clear way that it was explained to us, it seems there is a logic to it, and I'm not sure it's entirely counterintuitive to suggest that to people. I think they would get it. I think we singularly fail to underestimate people, to be honest, when we deal with them. And I think if people have enough self-interest at work here to make sure that they do the right things most of the time.
Okay, that's very interesting. Now, maybe it's just the popular press that want to make us believe that that's not the case. Ian Walker, who isn't a panelist, so therefore can't speak, said more or less the same thing. And also, can you hitch onto existing metaphors or concepts, which I guess is what you were saying. If you can explain it simply in words that people can understand, then anything is communicable.
Totally.
Mark Chaplin has been on to tell us what RAMP is. Maurice Chiodo has a lot of concerns. He's said them a lot of times about not the supermarket boss, not the school person, but the sock manufacturer, who wants to be able to apply some of the principles that they've seen in this document. What should we, I'll open this up to everyone, maybe David or Chris or Rebecca Hoyle, who hasn't spoken yet, who's one of our organisers, would like to talk about how should we engage with the sock manufacturer or the car mechanic around the corner, who perhaps doesn't have a massive HR function, doesn't have any R&D, doesn't have policy people working for them, etc., doesn't have any track record of working at this slightly abstracted level. How do we, if they've got hold of our document, engage with them, given that so far we're quite adamant, we're saying we're not providing advice? I don't know whether, Rebecca, you'd like to come in on that?
I think it's a really difficult question, in all honesty. We can engage with people who we know have got our document, and we're very happy to, and we'll talk to anybody who's interested in understanding how our principles could help them. We might not be the right people always to answer those questions, but we're quite well connected to others who might be able to. If we don't know that they have our document, it's difficult for us to engage with them directly, and I guess that is why we sent it out with health warnings and caveats, because what we're offering are some ways of thinking about some of these problems, but we did explicitly say that they would need further development for implementation in a particular context. So I'm not sure that has helped exactly, but I think, you know, we do need to accept the limitations that we have. And yeah, we will talk to anyone who'd like to understand better.
Yeah, I mean, from Maurice's point of view, Maurice, if you are a sock manufacturer, I think the key is, after this, we've got 5 minutes left, send an email to those 2 addresses. I don't know, as we move towards the end, I think, Matt, if you could share that slide that had your email address and David's email address. And I should also point out what V-KEMS, where this comes from, is. V-KEMS is a brokering house. That's essentially what it tries to do. It's trying to connect problem owners, stakeholders, people with questions that maybe or maybe not can be posed mathematically with mathematical modelers. And the idea is to triage problems and pass them on. So we're not offering ourselves, as it were, as a consulting house, but rather if you, after this call, if you have further questions, perhaps pass them on here. Richard Pinch is making a very good point. Richard is a distinguished mathematician who's has a long track record of knowledge exchange in the mathematics community, also with government agencies where secrecy is important, is saying that what we have to recognize is that there only are finite resources. And Maurice is telling us he doesn't make socks, he's a research mathematician, very good. Richard is saying that the issue, really, the difficulty is we have finite time, and there's finite resource in the sock manufacturer, there's finite resource in us, and they need to know the answer by Monday. Does anyone want to come in on that? Perhaps I'll leave the final word with David Abrahams as we're getting towards the end. This thing about urgency and how do we get answers in real time?
Yes, thanks very much. Can you hear me, Alan?
Yes.
Okay. Yeah, I think it's drawn nicely to the conclusion about what the name of the game was when we started, which was to reinforce it again. It's about principles, and the principles should be understandable. So we tried to make them intuitive by definition. So we had things like table surface principle as opposed to counter surface principle. And some of them look contradictory to each other. So one may be table surface, which means you have someone who's in the center serving a closed community, and others which are make a chain if you have a network of people, which seems to be the opposite. However, with some small explanation, we can see how to go from one to the other. So I think that what we're trying to do is create the principles from which the guidelines will be drawn by other people, and those guidelines will be given by ministries in order to make them work in workplaces, large or small. So I think our role is only, as Richard said, is limited because we don't have infinite resource. But I think there are a number of other things which we need to think of moving forward. I think Tim said about homogeneous social networks have been assumed. The inhomogeneity of social networks are a very big element in terms of the spread of the infection, and we need them to bring them into our principles. So there's more work for us to do, but I think this has been useful, and we're happy to do more along these lines in future, which can help produce understandable and coherent principles, but I don't think we should be more ambitious at this stage.
Thank you very much, David. Thank you, everybody. By my reckoning, we've come to just about the end of time. This has been recorded and will be available as a resource. Please do email either of those email addresses there, particularly if you have or you know a contact of someone who has a particularly pertinent question of manufacturing socks, school timetables or whatever. So thank you all very much and goodbye.